Chapter 11. Therapeutic Communication. Improving Therapeutic Communication. If you want to improve your patient's safety and cooperation, you need to be more effective at therapeutic communication. Many times, ineffective communication can result in conflicting information, and patients may feel uncomfortable or apprehensive about certain things. The following tips can help you improve the quality of your communication with patients. By practicing these tips, you will be able to help patients cooperate more efficiently and safely with your treatments. Also, read on to learn more about the various aspects of therapeutic communication. Ineffective therapeutic communication causes patients to feel apprehensive. Ineffective therapeutic communication is the root cause of the patient's apprehension during therapy sessions. A number of barriers to effective communication exist. These barriers include challenging and probing behaviors, changing the subject, and false reassurances. Other barriers include rejection, stereotyping, and judgments. The following are some ways to reduce the patient's apprehension during therapy sessions. Effective therapeutic communication improves patient cooperation. Many nurses report that ineffective therapeutic communication can hinder the process of patient cooperation. While the patients themselves may not know the best methods of communication, nurses who know about these techniques will use them. Attitudes are a person's inclination to act in a certain way. Nurses who study the attitudes of their patients report that some patients know more about the process of nursing than others. Although this is not surprising, it is still surprising to find that the families of patients can be highly influenced by the communication style. A nurse may use an effective therapeutic communication if a patient is a new patient or a nervous patient. Anxiety also may delay therapeutic communication. Other barriers to patient cooperation include noise. Noise from other sources can interfere with any type of communication. Some patients turn on their radios while speaking. Nurses may chat on the telephone too much, which may also hinder effective communication. All these factors can impede patient cooperation. Effective communication can help physicians deal with patients' anxiety and compliance with treatment. Effective communication may reduce patient anxiety and enhance patient compliance, resulting in a positive experience for all involved. For example, one patient refused to undergo catheterization despite his doctor's advice. The physician interpreted this behavior as a sign of ineffective communication and was able to persuade the patient to undergo the procedure. The patient's response was highly indicative of a doctor's communication skills. A nurse who demonstrates effective therapeutic communication is likely to achieve many goals and benefit from the relationship between the nurse and patient. Ultimately, effective communication enhances patient cooperation by providing details of the patient's thoughts and feelings. For effective communication to occur, a nurse must foster rapport and trust with the patient. An effective rapport involves a mutual respect and trust, and the patient should feel comfortable discussing their personal concerns with the nurse. Effective therapeutic communication improves patient safety. Ineffective therapeutic communication between clinicians can compromise patient safety. When the right information is not available to the right person at the right time, it can lead to inconsistent treatment plans, inadequate follow-up, medication errors, and increased polypharmacy. Ineffective communication is also associated with poor patient safety, a major concern for healthcare providers. The following table presents some possible explanations and implications for practice. While many factors are at play, some are common. Lack of communication is a major source of patient safety problems. Hospitals often experience lengthy delays due to lack of communication between the staff. These delays lead to increased hospital stays, lower patient satisfaction scores, and increased costs. Improving communication skills for nurses. As a nurse, you must possess excellent communication skills. These include active listening, validation, and honesty. In addition to these, you should be aware of the importance of active listening and teach back. Several ways to improve your communication skills as a nurse are discussed below. Using the correct language can improve your patient care. If you have any problems or questions, please feel free to contact us. We will be happy to help. Active listening. While a healthcare worker's job is to give full attention to a patient, they may find themselves distracted by their own thoughts and feelings. This distracting mental state affects the quality of care a patient receives. By actively listening, a health professional can absorb information more easily. This skill is a vital part of the nursing process, but it is a learned behavior. The best way to develop it is to practice it. To practice active listening, nurses should ask patients for clarification when they are explaining something to them. The most effective way to do this is to ask broad opening questions that allow the patient to talk about whatever's on their mind. If a patient feels uncomfortable talking about their feelings, the nurse should encourage them with verbal and nonverbal cues, such as a nod or an eye contact, to encourage open communication. Nurses can also offer general leads. If a patient has a similar situation to one that they are experiencing now, nurses should encourage the patient to draw on this experience. Active listening allows patients to share information, develop empathy, and make comparisons. The nurse can record the conversation by asking open-ended questions and concluding by asking, "Does that sound right?" Lastly, nurses should pay attention to patient comments. Patients respond to nonverbal cues when they are actively listening to what they're saying. For example, they might say something in a loud tone, but not of their body language catch it. They may respond more effectively with nonverbal cues, such as a slurred word. If a nurse understands what a patient is trying to say without interrupting them, they will be more effective in their nursing skills. Validation. One of the most important tools nurses can use is validation. When people feel that their feelings and requests are being heard and understood, their well-being increases. Nurses who use validation to express their needs can strengthen their relationship with patients and their families. By acknowledging someone's needs, they will be able to more effectively respond to requests and improve patient care. It is also an empowering tool for family-centered communication and can help all parties feel heard. A self-efficacy scale for communication skills is a helpful tool for evaluating these skills. It can also be used to create institutional strategies for effective communication. In this study, the Spanish version of the Self-Efficacy Questionnaire 12 in communication skills was validated as a valid and reliable instrument. Further, it is essential for the validation of communication skills for nurses. The results of the study are discussed in the following paragraphs. In the course of patient communication, it is important for nurses to understand the perspective, beliefs, and perspectives of the person they are talking to. For example, nurses must determine if the patient's nonverbal expressions are indicative of pain or disgust. As a result, nurses should be sure to clarify the meaning of every nonverbal gesture. In addition to this, nurses must learn to read the body language of their patients. A nurse's interpersonal communication skills can significantly affect the quality of interventions in different care services. Nurses who can listen to a patient and validate their feelings and opinions are more likely to build trust with their patients. This, in turn, increases the quality of decisions, patient motivation, and clinical outcomes. Therefore, nurses must learn to listen to others in order to be an effective communicator. This skill is particularly important when dealing with patients and their families. Validation is an important part of communication. A key part of effective communication is validating the perspectives of your clients. This includes understanding how your clients view issues and their own experiences. Then, you can understand how cultural differences can challenge health professionals and service users. Understanding how to properly validate someone's experiences and views can help you build better rapport with patients, families, and colleagues. Here are 4 examples of validating other people. Identifying your client's values, beliefs, and perspectives will help you understand how to best address their needs and concerns. Communicating effectively requires accurate assessment of the individual's beliefs, values, perspectives, and perceptions. Nurses must also consider the recipient's nonverbal cues. Nonverbal grimacing, for example, is a signal that the receiver is in pain or disgust. A skilled nurse will be able to interpret nonverbal cues and determine what is being communicated. When interpreting a patient's language and body language, nurses must ask their patient if their understanding is correct. Many misunderstandings arise when people fail to check the meaning of words. When delivering an explanation, the nurse should ask for confirmation from the patient. Similarly, eye contact and the position of the body should be consistent. Verbal responses should be regular and encouraging, and the response should show that the nurse understands the facts and emotions expressed by the patient. Nurses who develop critical thinking and self-examination are the best communicators. Nurses with this skill are able to integrate theoretical knowledge about communication into their practice and evaluate the effects of their actions. They can also be effective communicators by developing their creative and critical thinking skills. This is a critical skill to have if you want to improve your communication skills. All this will help you become a better nurse. Honesty. Effective communication is essential for nurses to build rapport with patients and solicit important health information. Effective communication among members of the healthcare team also ensures a smooth patient journey. In a busy clinical workday, it is easy to get lost in the shuffle, and when a healthcare worker comes across as uninterested or cold, they may endanger the patient-provider relationship. To avoid these problems, nurses should adopt a positive self-image and practice openness. In end-of-life care, good communication skills are especially critical. Oftentimes, patients and caregivers are uncomfortable with words such as death. They may be afraid that by being honest, they will be betraying hope. However, honesty allows them to explore alternative possibilities and even talk about a good death. Nursing professionals must establish trust with patients by being honest and respectful in their conversations, regardless of their role. Nurses should always face their patients and communicate with them on the same eye level. This way, they convey mutuality, equality, and a position of power. The patient will also be more likely to be open to listening to their nurse when they are able to feel comfortable and relaxed. Also, nurses must establish trust by introducing themselves and letting patients know they can talk to anyone. In addition to oral communication, nurses must be able to understand the needs of their clients through written correspondence. Nurses should be able to write clearly, as they will be able to share important information with their patients. In addition to writing clearly, nurses should be able to speak with patients in a manner that is clear and professional. They should also be able to use medical terminology and abbreviations correctly, avoiding harmful silence. There are several factors that contribute to the issue of avoiding silence when communicating with nurses. Several studies have shown that nurses often fail to communicate when they have a problem, and this silence can have adverse effects on the health of patients. In addition to health-related quality, the problem can also affect patient safety. If you notice that the silence in your department is affecting patient care, consider how you can improve the situation by addressing the root cause of the issue. When two parties lack common ground, conflict results. Though conflict is necessary and often offers an opportunity to express different perspectives and values, it can become an impediment to communication. Moreover, it can detract from the task or purpose being carried out. Nurses often strive to achieve collaborative relationships with patients, families, and colleagues. However, they often feel unable to accomplish this goal if they cannot communicate effectively with others. One way to overcome this dilemma is to practice active listening. It involves showing interest in the patient and engaging with them throughout the conversation. By offering general leads during the conversation, the nurse can propel the discussion. Using silence can also give both the nurse and the patient time to think and broach new topics. This technique is particularly helpful in patient care, but remember that there are times when silence is necessary. If the silence is too long or uncomfortable, the patient may feel unwelcome, and the nursing staff will be unable to help them. When you are speaking with patients, be sure to maintain eye contact with them and avoid defensive posture. Make sure to maintain eye contact with them so that they feel that you are communicating with them on a level that is respectful to both of you. You should also maintain an open posture, which conveys equality and mutuality. It is also important to avoid a defensive posture because it can cause confusion in interpreting what the other person is saying. Using silence as therapeutic communication. Silence as a therapeutic communication tool can be beneficial in many counseling sessions. Intentional silence can help counselors process material from clients. This is an excellent way to facilitate reflection or reassurance, as well as to facilitate a natural end to the session. Silence allows counselors to process client material without paraphrasing or giving advice. The silence can also help counselors process material and understand the client's material more clearly.